Welcome everyone to Hearing Loss Association of America, North Bay Chapter. My name is Sarah Ozer. I'm president of the organization. Our vice president, Tana Cooley, is here, and Jim Ozer is here for tech support. Alan Katsura will be recording the meeting and uploading it to HLAA California State YouTube channel. Today, we have with us Heather Little, AUD, a member of CCCA. She was born and raised in San Francisco and joined Connect Hearing in May of 2023. Dr. Little's educational preparation began at California State University, Sacramento, where she was awarded her Bachelor and Master of Science degrees in speech pathology and audiology. She received her doctorate from Salus University, former known as Pennsylvania College of Optometry, School of Audiology, in June of 2007. She is a certified member of the American Speech, Language, and Hearing Association, a fully qualified member of the New Zealand Audiological Society, as well as the California Speech, Language, Pathology, Audiology, and Hearing Aid Dispensers Bureau. Dr. Little has spent time working in the Sutter, Kaiser Permanente, and Stanford healthcare systems, as well as overseas in New Zealand, gaining valuable experience in all aspects of clinical audiology. One of her most rewarding experiences was when she became a licensed hearing aid dispenser and began working in the private practice and retail sectors. It was at this point that she was able to truly appreciate how hearing devices can change, enhance, and improve a person's quality of life. Currently, Dr. Little is specializing in both adult and geriatric diagnostic testing and amplification via telehealth and in person. In her spare time, she enjoys training for 10K races, yoga, hiking Marin, cooking, wine tasting, as well as spending time with her family in the Bay Area and Spain. So, Dr. Little, we welcome you today and we'll let you speak now. Thank you for being here.
Thank you for having me. Let me share my screen. All right. Can everyone see that? Perfect. Okay. All right, so you gave a very nice background of myself. As you were saying, I was born and raised in the Bay Area. I've only lived in California or in New Zealand, which I moved to New Zealand back in 2008, and then came back in 2011. When my husband and I decided that we wanted to have children, we ended up moving to Mill Valley in Marin, and we've got a 4-year-old and a 10-month-old. So I've been on maternity leave for a while, and I just started working at Connect Hearing in May of 2023 of this year. I've been an audiologist for 22 years. I can't believe 22 years have gone by that fast. And like you said, I've worked in medical, private practice, and retail environments. But the patient populations that I've dealt with have been pediatric, adult, and geriatric. I miss working with kids, and I'd love to work with kids again, but I don't know if that's something that I'll be able to do in my current role. Now, when we talk about telehealth is the use of electronic information and communication technologies to provide and support healthcare when distance separates you from the patient or from the provider. And when we think of telehealth, a lot of us didn't start thinking about it until the onset of COVID, but telehealth has been around since 1925. It wasn't widely adopted until the 21st century, and that's when technology and policy changes enabled it to be more accessible and affordable to implement. And telehealth was first established as a Medicare service in 2002 and was used in rural areas or areas where there were provider shortages. And that tends to be one of the big reasons that we use it even now is provider shortages, especially in California. As we all know, it's very expensive to live in California, so it's incredibly difficult to find well-trained providers in all fields that can afford to live here. And we still don't use telehealth to its maximum potential. But what some of the benefits of telehealth would be increased access to patients, health providers, and again, especially specialty providers. It helps to reduce wait times for appointments and increases flexibility of appointment dates and times. Like for me, I am covering two different clinics. I cover Santa Rosa and I cover Healdsburg. So sometimes I will see one patient maybe at 9 o'clock in Healdsburg, and then I will quickly log in at Santa Rosa. So I can see patients in two different offices in the same day. Now, a lot of times you can get a more engaged client when you're using telehealth. And again, it increases the flexibility and convenience for clients, audiologists who can save on their travel costs as well as time. You also have access to a wider patient base. So those living in more remote parts of the state now can see providers that are in different areas of the state. And provider and patient safety that we all know about during COVID-19 circumstances. It's a lot of times it's safer. Let's say I was sick at one point, but I could still see patients remotely because I wasn't in the office, and vice versa. Increased communication between providers and patients. It's a lot easier to communicate via email and teleconferencing. There's, again, the reduced travel burden for the patient and the provider and the increased efficiency of the provider's schedule. You can have better follow-up and increased timeliness of care. But telehealth also in audiology expands the possibilities for involving others, like family members, interpreters, or friends that can be conferenced into appointments that are unable to attend the appointments in person. Now, there are three different types of telehealth that we usually talk about, and that's going to be synchronous, which is real-time provider and patient at the same time. Asynchronous, it's more of a store and forward. Patient is seen or services are provided without the provider present. And then hybrid. Real-time or synchronous telehealth is usually the preferred to asynchronous because it allows for live interactions with the patient, their significant others, or trained assistants. The benefit would be immediate feedback for the patient. And these appointments can take place using different devices such as a phone, a tablet, a laptop, desktop computer, and may use modes such as apps or video conferencing. Video conferencing platforms with live captions, like today, are recommended over audio-only options. The captions are very helpful for those with diminished hearing and those where English is not their first language or maybe not their language at all. It tends to rely more heavily on broadband as well as a health aide who is trained to be the additional eyes, ears, and hands for the provider during that appointment. So in many of my appointments, the audiologist controls the computer at the location where the patient is. So they use a remote desktop application sharing software. I take over the computer and I perform all the same tasks that I would normally do in person. And the patient can be at home or at work and connect to the provider's computer via an app on their phone, which is connected to their hearing aids or by video conferencing using Microsoft Teams or Zoom. So this option would be considered a direct-to-patient model in the home. The other option is where the patient is going to the clinic and the audiologist or provider is at their home or a different remote location. Asynchronous, or store and forward, is where communications between the patient and the provider occur at different points in time. So in audiology, this could be the patient that sends a message through their patient portal, or they send an email. They may send an image or test results from another place, or request that is stored until the provider has time to access it. When it is used, other times would be, let's say, when you're getting patient intake before an appointment. Somebody may email you the patient intake form, you fill it out and you email it back. It can also be used for follow-up care or for hearing aid programming change requests, questions, or general problems. Hybrid service is exactly what it sounds like. It's a combination of synchronous and asynchronous. So it could be remote patient monitoring through the mobile apps and or in-person services that are implemented to meet the needs of the patient. So telehealth can be the primary mode of service delivery, or it may supplement in-person services. And a lot of times this will happen because certain insurances will not reimburse for services that are not done in person. Some of the managed care insurances that I deal with, they're fine with you doing the hearing test via telehealth. They're fine with follow-up via telehealth, but the fitting must be done in person. And so for me, that's why I go into the office some of the time. Other uses that we use telehealth for can be telesupervision or distance supervision. Involves supervising trainees who are in different locations and can allow trainees to have a more rich and diverse experience at various locations throughout the state. It enables students or clinical interns to observe or engage with a patient who is in a different location and gain more practical experience of what telehealth is and how it's used. It can also be used to mentor another audiologist. Now, I use this a lot where I'm at, because we have a lot of trainees and we have a lot of other providers in different locations that may need help. And then I've been using this for quite a long time. It's distance education. It's used to support the professional development of audiologists and involves participating in live and or on-demand training sessions. You know, as a mother, as a working mother, it's too hard to fly to go to conferences now. So it's so nice to be able to do live conferences online or live trainings online. Now, some limitations of telehealth in audiology is the reluctance from patients to use the technology or the lack of capability to do so. Some services, like I said before, can only be delivered in person, but that's more like such as taking an ear impression. However, there is technology available to scan the ear without the invasiveness of an ear impression. The problem with that equipment is quite expensive. So the additional investment in equipment to deliver some of these services by telehealth sometimes makes it hard for clinics to provide those services. Some other telehealth considerations: a real-time synchronous appointment may take longer than in-person hearing care. It may take more time to explain the technology to the patient and make sure that they are properly connected and comfortable with the mode of communication. Hearing assessments may also take longer for technical reasons such as internet speed and audio quality. During the appointment, people who rely on captions may require some time to read and digest the captions as they appear on the screen. And then there's additional time is required for an interpreter to process the information between the audiologist and the patient. But in all, the hearing care of the future is not location specific. And in most cases, care will be a hybrid of in-person and remote services. Now, moving on to over-the-counter hearing devices. Sarah, you had mentioned that you wanted me to speak on that. According to the FDA, over-the-counter OTC hearing aids are devices that can help amplify sounds for people with mild to moderate hearing loss. These devices are available without a prescription and can be purchased online or in stores. And while these devices can be helpful for some people, they are not suitable for everyone. So there's no requirement to see an audiologist to purchase. You don't even have to get your hearing tested. It just needs to be someone that perceives they have a mild to moderate hearing loss, and they can purchase and self-fit or self-control the devices. Now, the three major audiology associations, which are the Academy of Doctors of Audiology, ASHA, American Speech, Language, and Hearing Association, as well as the American Academy of Audiology, have all encouraged members to be active in the OTC channel, whether that's providing diagnostic testing or providing recommendations or even selling over-the-counter devices themselves. They could also provide support for patients who have purchased over-the-counter devices. Some of the potential negative outcomes of OTC devices is the possibility of improperly treating a hearing loss or purchasing a device that provides no benefit. They may have trouble operating and or cannot return the devices. And the major thing for me is that there's no hand-holding for patients. Many of my patients need extra help with learning how to insert, clean, and maintain their devices. One other thing is that there's no pre-market clearance by the FDA, and this could potentially lead to unethical companies selling low-quality devices. There was a survey that was conducted by Abram Bailey. This is actually an audiologist that I worked with in New Zealand, and he runs Hearing Tracker. And he showed the following top 10 concerns with the introduction of OTCs. We are concerned that consumers will struggle to identify and address common problems like moisture and wax issues. That consumers will not be educated on realistic expectations about what the OTC devices can do. They will also not be educated on effective communication strategies, or they might miss medical red flags and fail to have pathologies diagnosed and treated in a timely manner. Or they will not be able to accurately predict the level of their hearing loss. If you haven't had your hearing tested, how do you know if you have a mild to moderate hearing loss? They will not have adequate access to services when their hearing aids malfunction, or they won't be educated on hearing protection or conservation. Or they might be more confused about what's available in the hearing device marketplace, or struggle to program the hearing aids appropriately on their own, or they won't be able to provide the same level of benefit as professionally fitted hearing devices for those with mild to moderate hearing loss. But some of the potential benefits of OTC devices is it allows sales of devices in a non-traditional outlet. The potential of clinics to begin to unbundle. In that situation, it's because of devices being out in the marketplace, this could potentially encourage clinics to unbundle their pricing to offer more transparency with the cost of the device being separated from the professional services provided. And more access means more people using hearing devices. It could also decrease the stigma of wearing hearing devices and help patients feel more empowered to wear them. You had asked what kinds of devices, if I'm involved in that. And so OTC devices, I work for Connect Hearing, which is under the umbrella of Sonova. And Sonova recently introduced their own OTC device in July of this year. It's called the Sennheiser All Day Clear. It's a new self-fitting hearing aid that has optional support from a hearing care provider. And then there's the new Sennheiser All Day Clear Slim, which is compact, rechargeable, and compatible with both Android and Apple mobile devices. Both of them are compact and rechargeable, but the other one is more of a slim look to it and feel. I myself have not fit any of these yet, since they just came out 2 months ago. And I'm not sure if telehealth will be involved in that, at least with Sonova. Right now, their main focus has been on launching telehealth and having it more available for every clinic. So I rarely, and I also rarely deal with patients with mild to moderate losses. Most of my patients are quite involved and need lots of help. However, if they did need help, video conferencing, phone calls, and emails would all be appropriate for these patients. Okay, and thank you so much for your time. I just left some more time for questions.
Okay, thank you for that information. Excellent.
My
So
pleasure.
there is a question in the chat. Is there an age limit on over-the-counter hearing aids?
I believe it's 18.
At least 18. Okay, but is there some kind of upper limit?
No. No.
Okay. And there's a question here. Is telehealth a brand name, or is it a technology with many different providers?
Telehealth is it's telemedicine. So it's for everything. It's for anything that you're doing remotely.
Okay, are there any questions? Would you like to raise your hand if you have a question? Let's see if I can see everybody. Tana?
You're muted.
There's someone working upstairs for me, so I have my mic off. If it gets noisy, that's what it is. I wanted to thank you for coming. I appreciate that a lot.
My pleasure.
I have two questions. One is, I'm assuming you can't do real ear measurements with telehealth?
You
can?
can.
How does that work?
So you have, so what would happen is the patient shows up at the office and there's a health aide there, and they're the ones that put in the probe microphone, and then I control the computer and run the measurement. So yes, you can. You can't do it when it's an appointment at home, but you absolutely can do it if they go into the office.
So that raises a separate question. Maybe I missed this, but I kind of know it from somewhere else. So for telehealth to work around hearing devices, you have to send some kind of a kit to the client. So how do you have a probe microphone then?
So what happens is I'm remote, but the patient shows up at the clinic. And at the clinic, I have a health aide or an audiology tech that helps with the appointment. So they're the ones that open up the computer, and then I take over the computer and I run all of the tests, because my testing software is all PC based, as well as my real ear measurement machine. All of it's PC based, so I can control it. But what happens is the health aide goes in and inserts the probe as well as the hearing aid, and then runs the measure, and then I run the measurement. So you can do it all remotely.
Okay.
Does that make sense? It was hard for me to wrap my head around it when I first was approached to work remotely, because that was my concern too. I'm like, well, how am I doing this? Because when I thought of telehealth, I was thinking of the patients at home, and then I connect to them remotely. But no, it's the other way around, or both. It just kind of depends on the situation. So like today, everyone, all of my patients today, except for one, showed up at the clinic in Healdsburg. There's a tech there. She opened up the computer and logged into Microsoft Teams. And then I did my entire, I collected all of the history. And then I ran I told them what we were going to do. We looked in their ears with a video otoscope. I took a picture of the image of the ear. And then we ran the hearing test with me controlling the computer, just as if I was there. So it's the same thing with real ear. When I fit the hearing aids, I'm the one that is controlling the computer and programming the device. And I have somebody there to just be my hands.
So I get that, but for some reason I was envisioning telehealth happened at home.
It's both. It's both. It can be at home, or it can be the provider can be at home, or the patient can be at home. It just kind of depends on what kind of an appointment it is.
So let's just take it through if it happens at home. So I give you control of my iPad or my computer the same way you do an Apple support person.
No. So if you're at home, the kind of appointment that I would normally do with you would be a follow-up appointment. It is possible to do, a hearing aid evaluation and a test. I just don't, I haven't done it that way. The patient shows up at the clinic and I test their hearing. And if it's an appointment that is where the patient is at home, it's either a video conference appointment where we're discussing things and they have questions, or I'm logging into their phone or their iPad through their hearing aids and I'm making adjustments to their hearing aids. But they've already had their hearing tested and they've already had real ear performed at that point. So this is just for follow-up appointments when the patient is at home.
Okay. Thank you. My second question was something you just mentioned, is something I've been curious about. And since you're here, I'd like to ask it. You were talking about the ability to scan for making ear molds. Can you tell me a little bit more about that technology?
So I just found out about it myself because I had been complaining about how it was a waste of my time to drive all the way to a clinic to do an ear mold impression. And there's one of our clinics has software. Actually, it was another audiologist that told me about it. She goes, oh, I can't remember the name of the company that does it, but she says, I have such and such. I don't do ear mold impressions anymore. She wasn't comfortable doing them. So she has a machine that you put in the ear and it scans the entire ear canal, and then you email it to the manufacturer and they make the ear mold based off of this scan. And I said, I want one of those, but it's expensive. So I haven't been able to get one yet.
Okay.
But they do have the technology.
Yeah, when you said that, I imagined those things that they now use to scan for making crowns in your mouth or something.
Perhaps I haven't seen it. I've seen what it looks like on the outside, but I haven't seen it used yet. But I'm hoping that will be something that I'll be able to get in the future.
This is kind of a big deal to me because I have a profound loss, and ear molds are really, really challenging for many people to make for me. And if we could get past that into actual scans, which are accurate, that would be amazing. And also just a personal side note, in watching hearing loss forums over the years, I often wonder if audiologists really get trained in making ear molds. The number of people who have problems with ear molds constantly is just astonishing to me.
Yeah. And I think a big reason for that is the fact that I was trained when ear molds were a standard. I fit everyone with ear molds because I started dispensing 22 years ago. So I'm very comfortable doing a tight, deep impression. My ear impressions are very good. But then you get all of these new audiologists who very rarely are fitting behind the ear hearing aids. So they're not very often doing ear mold impressions. And if they do, they're pretty shallow. Now that we've got all of those receiver in the canal devices, people are just doing domes. And so I've had trainees that don't even know how to modify ear molds when there's a problem, or they don't have the equipment to modify. So yes, it is a problem. And that's one of the reasons why. So it'd be nice if all of us had the equipment, but I still think, because I know that they're getting trained on it, but then it's hands-on training is the problem. Because if there's not enough patients that you're doing ear mold impressions on, then how are you learning to be confident in it?
Okay, thank you.
Anyone else?
Ann Thomas.
You're muted.
It's my understanding that one of the criteria for something being called an OTC hearing aid is that it is not fit by a professional.
Correct.
So I'm a little confused when I was hearing you talk about fitting OTC hearing aids in the office.
Oh, I meant selling, not fitting. The patient sell, like, they can purchase it from the office. I haven't sold any, but many companies they're saying, you can sell them, but it's basically like, here's the box. And then they would program them themselves or
So
take them out of.
just why would an audiologist choose to do that?
I wouldn't choose to do that, but they may choose to do that so that if they have any problems or they decide that that's not enough for them, that they can come back and they have a place to come to and purchase regular hearing devices.
Thank you.
Oh, Sarah, you're muted.
Oh, yeah.
It's a common thing.
Okay,
Okay.
any more questions from our participants? So, Dr. Little, I want to thank you so much for the presentation.
My pleasure.
It's made us think so much about telehealth and the different kinds there are and the different options and what the future may hold with
Mhm.
this. I think we're all just anxious to see how over the counter is going to play out. And what you're doing is so exciting that you can be in different locations and have someone in your office
Yes.
assisting you.
Yes.
I want you to know that I did see that machinery for making ear molds at the AAA conference in 2019 up
Mhm.
here in Roanoke Park. There was somebody selling that machine. So,
Mhm.
wow, that
Mhm.
was quite amazing what I saw.
Yeah.
Okay,
thanks.
so if there's nothing else, we know you have a busy life. We will
Gotta go
thank
pick up the
you.
kids.
Yes,
Thank you
pick
so
up-
much. It was fun.
And then everybody else, please stay for discussion and socializing. Bye.
Bye now.